Dr. Terry J. Smith, a professor of endocrinology and neuro-ophthalmology at the University of Michigan, thanks for joining us.
Good morning.
You're considered as one of the world's leading scientists in the field of thyroid diseases, particularly thyroid eye disease. Ted, please explain us about the disease and its effects.
Yeah, so the TED, or thyroid eye disease, as we call it, is usually accompanied by abnormalities of the thyroid gland in a syndrome we call Graves' disease. And it affects women far more frequently than men, and is often unrecognized, and therefore is not optimally managed. And we hope that the current efforts to better understanding and recognizing the disease will translate into more patients being receiving the best care possible.
So you're talking about the efforts. Tell us about your discovery.
So what I have done all of my professional life in my spare time is to study molecular biology, trying to understand how diseases develop, what the mechanisms involved happen to be, and in so doing, how to identify targets that we can develop drug therapies for, and as specifically as possible target those mechanisms, and therefore develop therapies that are not only effective but also don't cause side effects. And if the side effects occur, that they're mild and self-limiting.
So you believe that the drug could be able to treat the disease, to cure, or just to minimize the effects?
Well, the therapies that we've been involved with evolving have the potential of doing far more than masking the disease. We don't know yet whether we're on the right track to an actual cure of the disease, but for the first time, at least in TED, we have a drug that gets to the mechanistic heart of its cause.
And I must say that you're lucky to be able to see the patients who will enjoy this discovery, not only observing the mechanism, but also maybe bring a cure, future cure.
Yes, we think that this is something that we all aspire as a group of physician scientists. Not only that we take care of these patients, but that we potentially innovate in a way that leads to a therapy and potentially to a cure.
One last general question about the U.S. healthcare system during the current Trump administration. Do you feel a change in policies and in the approach?
We do. We're concerned about those changes. Certainly what the current administration has identified as their priorities include what seem to be drastic reduction in public investment in understanding diseases, that is, researching diseases that have public health consequences, and we are very cognizant of the fact that this reduction in support may result in us being far less effective in developing therapies and new diagnostic tools to identify individuals who will benefit from those therapies.
I understand. Professor Terry J. Smith, thank you for joining us today.
Thank you.